Well, hello, good morning, and welcome to you all. Thank you so much for joining us here in the Flemish Parliament and to everyone who's joining us online from across Europe. It's wonderful to see so many of you here in person at last. Thank you so much, because this is such an important occasion. We've come to discuss how we can make that vision of an EU health union into a reality. We have with us today a huge range of stakeholders. We have with us politicians from the European Commission, from the European Parliament. We have academics. We also have healthcare professionals from the local, regional, and national level. We have scientists, and very importantly, we have patient groups with us here today. And it's your input we want into this event. My name is Sue Saville. I'm an independent health journalist. I used to be the medical correspondent at Britain's ITV News, and it's my great pleasure to be guiding the discussions here today. We do want your participation, so do get onto the Slido app. You can get onto that at slido.com using the event code #EUHealth. Those of you online, it'll be on your screen, so do join. This is your way of accessing, submitting questions, and engaging with the events today. We very much want your participation. There will be roving microphones in the room when we take questions later, so raise your hands and be brave. It'll be lovely to hear your voices here in the room as well. So it was 4 years ago when the first EU Health Summit took place, and the EU Health Coalition was created by a fantastic team. But it's amazing, I think, looking back 4 years, who would have known then that intention to coordinate and improve healthcare across Europe would become so critical? And of course, the COVID pandemic then just exacerbated so many of the underlying problems in the healthcare systems in Europe. In 2020, the second EU Health Summit then called for time for action to improve the resilience of the healthcare system that had been so very strongly tested. Now, this is the third summit, but Europe's facing geopolitical, economic, energy crises at the same time. And at this session, we're calling for concrete steps towards an EU health union, because there's a recognition of the importance of health in our societies, in our well-being, in our economies indeed. And as a journalist, I'm really excited about this event because there's going to be an exclusive, hot-off-the-press announcement of the 9 new recommendations that have come out in order to help create that EU health union. And to reveal those hot-off-the-press recommendations, it's wonderful now to be able to invite to the stage the 2 co-chairs of EU Health Coalition, Nathalie Moll and Lynn van Poelhest. Welcome to the stage.
Thank you.
Over to you both.
Thank you so much, Sue. I'd just like to really echo Sue's warm welcome to everybody in the room and online. It's such a pleasure to be here again 4 years later. We did have an EU Health Summit in between. And before I forget, because I always forget, can I just say a very big thank you to everybody who was involved setting up the event. We'll say thank you for the recommendations at the end, but really a big thank you to the team. This is not an easy thing to pull off, and I think we're all very grateful for that. It sets the scene for fantastic conversations, so a big thank you. Thank you. I think we feel really privileged to be with you today because, as Sue said, we'd like to have a conversation about the recommendations. We have panels that will discuss each set of recommendations, and we really want a conversation about them. If you think they're good, they're bad, could they be improved? We're really proud of what we've achieved so far, but we want to go further. And we're really hopeful that by publishing the recommendations today, discussing them, we can then implement them, right?
Yes. Well, for me, it's great to be here. I wasn't sure whether I was going to be able to be here, but I flew in from my vacation south of Marbella late last night. At 1 o'clock in the morning, I arrived at Charleroi. But I'm here, and it's a very different environment, as you can imagine. But I think exactly what Nathalie said, we've come a long way. since the 4 years ago when we started. I came in a little later on the scene, very much from the patient perspective, and I think the types of people, the multi-stakeholder group we have today, we want it to be truly interactive, so please come with your questions. And yes, just to say that we've had a COVID pandemic in the meantime, which has put pay to a lot of our ambitions and where we're going and what we want to do. But I think now is the time, literally, we've got the 9 recommendations hot off the press, as Natalie said, and I think this is something that we really, really need to address today.
Thank you, Lynn. And just for those who don't have a background on the EU Health Coalition, in fact, we were not a coalition. We started with a summit in 2018 for the new elections of the Parliament and the Commission. We made 20 recommendations at the time. And then after launching those recommendations for the new period, we looked at each other and said, but we want to continue to work together. The patients, the scientists, the academics, the regions, the industries, we want to continue. We all have something in common, which is patience. This is really, and you would think it's hard to find agreement, but actually it's really easy when what you're looking for is better health and better care for patients. We have that in common, and compared to some of my working groups, the EU Health Coalition is a much easier place to find agreement. So I think that's extremely important. It was important then, but it's even more important now, because as you said, we've had the COVID-19 crisis. We are in continuous crisis since then. We have a war at our borders, we have economic and social difficulties, an energy crisis, and more than ever we realize that health is the basis for wealth, but also to be able to continue to offer everybody the care that they need. And I think it's really, if there ever was a time not to be complacent about health, it's now. We really can't afford to ignore the fact that our healthcare systems are one of the most valuable assets that we have. They have suffered and they need to be looked at and cared for, in particular if we want to continue to protect our patients.
Yes, very much so, Natalie. I think what we're talking about, health is key, and it's for everyone. It's not just for a few people talking about health, whether it's engagement or whatever it is. It's literally a time to act. And I think if we look at the strategic pillars that we're talking about in Europe, we really need health to be included in that, and we will make a plea and lobby for that as long as we can. So, message for the policymakers is today we have to act and not get into all the politics. I know there's this G20 summit and everything, and all the rooms here in Brussels are taken up by the politicians, which is not good for me because I didn't have a room for tonight. But anyway, that's sorted. But really the message is very, very clear. We have to advance, take it from here, move forward and do, and not just talk.
Thank you, Lynn, and that is exactly right. I think now is really the time to think big and together, and that's another thing that COVID taught us. Thank goodness, I think that we learned, because we had to, that alone we can't achieve anything. We couldn't get medicines across borders. Do you remember those days when we had to do the shopping for our parents, or at least certainly I had to, and you were afraid for your children, you had to teach them at home. We learned cooperation among research, industry, regulators. We were all there 24/7 trying to find solutions. And I think that mindset needs to continue, because the challenges that we're facing now are not any smaller. And really here you have a group of stakeholders that is completely dedicated, without any support, I have to say, to working on recommendations every 2 years to update them, make sure they're still relevant. But after that, we want to make sure they're implemented, otherwise they're useless. And I really call on you to participate in the panels. We believe our recommendations are future-proof. We believe they're ambitious but achievable. And we really count on you to challenge us, but then afterwards to also help them be implemented. And I'd like to, as a last word, just thank all the partners of the EU Health Coalition. We're more than 40 associations, the chairs and the working groups and co-chairs who've been working tirelessly. We have no support. We just sweat equity from everybody in the coalition. A big hats off to all of you and us, and let's have a great event.
And perhaps if you're not a member, become a member.
That's a good point. Thanks, man. Thanks.
Thank you.
Thank
Can you help me, Natalie?
Yeah.
Thank you very much indeed to Natalie and to Lynn, who have so set the scene there. I think that's it, isn't it? It's think big and think together. And you put together your 9 recommendations. Shall we just briefly put them up on the screen? I think we'll be able to see. And you talked about them being in 4 different categories. And we're going to be able to see those 9 recommendations that we're going to go through in some detail today. So there we are, falling into 4 categories: the digital transformation, boosting research and innovation, getting access to that innovation, and the integration of the systems across the European Union. And we'll be diving deeper into each of those areas. But first, we are delighted that we have a special video message from the Commissioner, Stella Kyriakides, who is the European Commissioner for Health and Food Safety. She sent us these words to launch the top of our summit.
Ladies and gentlemen, since 2020, the COVID-19 pandemic has been a major challenge for the world. It has highlighted the weaknesses of our health systems, affected all aspects of our lives, and underlined how healthy economies are dependent on healthy citizens. In addition, COVID-19 has been a wake-up call, and our response revealed a very simple fact. In the area of health at EU level, we can and must do more together. From the start of the pandemic, this was clearly something our citizens expected from us. We had to find solutions to deliver as much as possible for them. And that is how, for example, we managed to purchase and distribute COVID vaccines to all the EU citizens at the same time and under the same conditions. Building on this experience and together with member states, we came to the conclusion that we needed to create a strong European health union with 2 main aims. First, to reinforce the EU's preparedness to tackle emerging health threats in the future. And for this, we have already adopted reinforced mandates for our agencies ECDC and EMA, and created HERA to be our watchtower against future health threats. We also have a comprehensive framework for the management of cross-border health threats to be able to respond quickly and decisively to emerging threats together. However, building a European health union goes beyond crisis management. It is about building more sustainable healthcare systems that deliver better care for EU patients. This means delivering on our flagship initiatives such as Europe's Beating Cancer Plan to improve access to diagnosis, screening, treatment and care, and reducing inequalities across Europe. We want to be able to support and give hope to patients and their families at every step of their journey. Our pharmaceutical strategy aims to improve access to innovative and affordable medicines and support the competitiveness and innovative capacity of the EU's pharmaceutical industry. In parallel, we aim to unleash the vast potential of digital health with the European Health Data Space. This will provide wider access to safe health data to healthcare professionals, encouraging research and innovation. Ladies and gentlemen, we need a stronger European Health Union to collectively protect what our citizens cherish the most, their health. And to do so, we need even closer cooperation and coordination and unity between member states. We are turning the vision of our European Health Union into reality, and we're keen to include you as partners and allies in our endeavour. Thank you.
Yes, again, thank you, Commissioner. Wonderful to get those powerful words. Indeed, we're trying to protect what we all cherish the most, our health. And now it's my great pleasure to introduce our keynote speaker, who is Dr. Natasha Azzopardi-Muscat. She is the Director of the Division of Country Policies and Systems at the World Health Organization's Regional Office for Europe. Natasha, over to you at the podium for your keynote address. Thank you.
Thank you very much. I was president of the European Public Health Association, and we were very worried that health was slipping off the EU agenda. Well, we do know all that has happened since then, but there has always been this tradition of health coming to the forefront during a crisis. We can look back in history at the European Union. We can see that institutions are created immediately after a crisis, and then a lull seems to set in. And I think the fact that we are all here together today is precisely because this time we feel that it is too important to repeat this cycle of responding to the crisis and then letting health fade away off the agenda. And let me start by conveying the warm greetings of our regional director for the regional office of WHO in Europe, Dr. Hans Kluge. And as he likes to say, health is not everything, but without health, there is nothing. And I think it is in this sense also that I would like firstly to say that WHO Europe very much stands behind you and behind the recommendations that you have set out. And thank you for working tirelessly to keep health on the agenda. And it is always very much in our interest as the organization that strives to promote and protect health to see other organizations such as the European Union placing health at the heart of its activities. But today, I would like to talk to you a little bit about what we are doing also at the regional office and how we are working very closely with the European Union in order to complement the agenda as well as with other stakeholders, many of you who are in this room. And of course, as a starting point, I have taken what Natalie and Lynn have been referring to, the term that is the HarperCollins English Dictionary Word of the Year for 2022, namely the perma-crisis, which is defined as an extended period of instability and insecurity. And during this crisis, here we are. It becomes even more important than ever for us as WHO to work closely with our countries. What do? We go into countries through our country offices that are mostly concentrated in the eastern part of the region. We are one of the 6 regions of the World Health Organization. We cover almost 1 billion people and 53 countries. And we work to support and promote the health leadership and to support countries to really transform and bring their health systems forward to provide coverage, to protect people in times of emergencies, and to support health and well-being. And one of the interesting things that we found is that during the pandemic, a number of countries who perhaps traditionally hadn't been working so closely with the regional office felt the need to rekindle the ties because it was very clear that all countries were struggling. But secondly, and this is very important also, for many countries in our region who are not members of the European Union is seen as a model to aspire to, and what the countries of the European Union do is also providing a learning opportunity and experience for other countries. So the laws that you pass, the standards that you put forward are also acting as a benchmark that others would like to follow. So there is also this dual responsibility. And moving forward, I would like to start and touch upon what our co-chairs said this morning, the issue of complacency. So there was a time, I think around 5 years ago, where within the European Union there was the sense that when we were looking at the Sustainable Development Goals, the health box had been more or less checked. We were doing very well and we were on track. Sadly, our European Health Report, which was published earlier this year, shows that this is far from being the case. And the full impact of the COVID pandemic is as yet to be seen. But what we see already is that because of a large number of disruptions, because of the fact that we have backlogs and we are still struggling to catch up with our NCDs, because of the fact that immunization programs were also disrupted, and because, of course, of the fact, and I will come to this, that we have this mental health crisis, all of this means that we are not really on track to achieve the targets within the European region that we had set out in 2015 for 2030. And let's remind you all that 2030 is not far away at all. The good news is, however, is that we can change things. We should not be defeatist. We have the evidence. We know what works, and we just need to redouble our efforts in order to continue to work on combating these crises. In the European region at the moment, we are battling with 5 crises. We still have the COVID pandemic. There is the Ukraine war. We had monkeypox, but we also are battling with polio, for example, in some countries too. And the mental health crisis. So these are all issues that require this responding to the crisis approach. But on the other hand, let's not forget that 9 out of every 10 deaths in our European region are caused by NCDs. And this means that we need to keep our day-to-day bread and butter health systems work going. And this requires our health systems to be resilient. Now, we've been talking about health system resilience ever since the financial and economic crisis of 2008 and 2009. And let's take out our history books and publications from the time, because there are some very stark lessons, but also good practice examples that we can draw upon as we go through this other crisis at the moment, which is impacting. And we know that way back in 2009, 2010, 2011, there were countries who took political decisions to protect the most vulnerable, to protect their health systems, to protect public spending. And they saved lives. And it's time, again, to do what we know, what works. I would like to touch upon a few areas that I would like to highlight for key attention. So when we talk about building health systems resilience, I think it's very clear, and this emerged also during the pandemic, that we need to strengthen our primary healthcare systems. We're talking about radically reorienting our health systems to be primary healthcare based. But what does this mean? So what this means, for example, is that we stop looking at the health system just from the lens of the hospitals, and we look at primary care as our gatekeepers. I don't use that term any longer. We need to shift the focus. We need to sit on the side of primary healthcare and look out from the primary healthcare setting and look at the other pieces of the health system as being supportive to primary healthcare. Why? Because it is through primary healthcare that we have the best chances of tackling the social determinants of health, of bridging the equity gaps. And next year in October in Kazakhstan, when we celebrate again the Almaty anniversary, we will have a conference on the day before our regional committee that will focus very much on the lessons we have learned about how we need to strengthen primary healthcare going forward. What is very clear is that primary healthcare differs in every single country, in every single context, and action there must be local, with the support of local stakeholders, local governments, because it's not a one-size-fits-all. And we need to capitalize on the multimodal nature, face-to-face and digital, and on the multidisciplinary teams, which again brings me back to mental health. Why? Because in some circumstances, we know that at least 1 out of every 2 consultations has a mental health element to it, and mental health needs to be part of the primary healthcare teams. Moving forward, I was speaking about mental health. Just before the pandemic broke out, when we decided what would be our flagship areas for the European Programme of Work, we selected 4, and one of those was mental health. Why? Because we recognized already at the time that epidemiologically something was shifting in our society, particularly where the mental health of children, adolescents, and young women was concerned. We have longitudinal surveys, such as the health behavior of school children, that was throwing up some trends which were worrying. However, we have to admit that even within the European Union itself, mental health was not really at the heart of the policy agenda. I'm old enough to remember the hype around the Green Paper in 2005 that was then somehow peacefully laid to rest. And we are paying the consequences of that now. But never worry, because as a result of the mental health crisis associated with the pandemic, mental health has suddenly become everybody's business. And we have built a pan-European mental health coalition, which Hans Kluge and Stella Kyriakides launched here in Brussels in September 2021. And this coalition is gathering strength and momentum. And next week we will meet in Ankara in our first physical meeting of the coalition, where we will evaluate the work that is being done across 6 work packages. Again, as I think Natalie said earlier, this is work of sweat and equity. I liked the term because it brings together academics, non-state organizations, governments, and people with lived experience too. Just 10 days ago, we were in Greece celebrating Mental Health Week there with young people. And young people want to be part of this conversation. They want to shape this conversation going forward. Of course, we cannot ignore what is happening also with the war in Ukraine and the impact that this is having on the mental health of people in Ukraine. First and foremost, our regional director will be there for the 4th time this year, next week, but also on the population at large, because of social media and everything else. People everywhere are exposed to the very sad events that are happening over there. And I'm very pleased to say that we are working very closely with DG Santé and with the European Union to support the work on the joint action. I was delighted to hear mental health being mentioned in the State of the Union speech by President von der Leyen, and I think that this is the time not to let mental health slip off the agenda again. One of the groups whose mental health is really worrying us is the healthcare workforce. The healthcare workforce in Europe, as we say in our report published a month ago, Time to Act, is really a ticking time bomb. And we are very, very worried about the health and well-being of the healthcare workforce, because in some countries we are seeing a huge attrition. We are seeing resignations, but we are also seeing people who are still at the place of work who are unable to deliver because of stress, because of burnout. And all of this is also having an impact on our pipeline, because young people can see that this is really not an easy sector to work in. So on the one hand, they may be drawn to the spirit of vocation, but then very practically, when they start looking at work-life balance, at take-home pay, it really becomes a very big problem. And as I said, I think last week in another occasion, we can have the most beautiful health programs for cardiovascular disease, the best treatment for cancer. We can have the best treatment for HIV, for TB, for rare diseases. But if we are missing the health workforce to deliver the services, we may as well have nothing at all. Now, let me be clear, this is a really complex and wicked policy problem which will not be resolved unless we all take action together and at the highest levels. So whilst with primary healthcare, I was saying this is very much a local issue for local action, I think when it comes to the health workforce, we really need to think very, very clearly at the highest levels altogether. And our report sets out 10 areas for action, and we will have a high-level meeting in Bucharest, in Romania, in March. Why? Because a country like Romania, for example, trains more than the European Union average in terms of graduates per capita per year, so they're doing their job. But then when it comes to retaining the stock of health professionals, they are losing so many. So this is an area where the European Union, because of the acquis, because of the mutual recognition, also has a key role to play and to take forward. The key takeaways, the healthcare workforce is aging, availability varies very much, particularly when one looks at the north-south gradient, at the west-east gradient. The workforce has become feminized, and this brings its challenges too. And when we look, for example, at data and digitalization, we find that this is not working for the workforce. We don't even have the data that we need. And when we look at digitalization, where do we set the bar? Do we set the bar as such that we say that before any technology passes the test of being implemented in the health systems, it has to be approved by the users themselves, by the workers themselves? So moving on, I think I've made my point on the health workforce. Allow me now to come to patients. What are patients struggling with? In Europe, the main cause for out-of-pocket payments and catastrophic expenditure is payments on medicines. But what you will see is a very wide variability. Some people think that this is a problem only for countries outside the EU. In fact, not. Our office in Barcelona, that again works very closely with DG Santé and prepares the financial protection reports, has very clear evidence that patients in many countries are still spending far too much money on medicines. And we know that this is harmful, and we know that this erodes equity. What perhaps is less clear is that sometimes this is also an effect because of the fact that new therapies are so expensive that governments and funders feel that they need to make choices. And the easiest victims, so to say, sometimes to carry the burden end up being the patients. But here again, we are working very closely with stakeholders and also with industry, because this is again a very big and complex policy issue. You've mentioned the review of the pharma strategy. As WHO, what do we offer? And we got a resounding endorsement in Tel Aviv a few weeks ago, is to continue the work that we started with the support of the Norwegian government, the Oslo Medicines Initiative, to try to find a new social paradigm going forward, one that recognizes that Europe wants to be a leader when it comes to research and innovation, but equally one that recognizes that innovation that remains on a shelf, that innovation that does not reach the smaller markets. I was with Latvia, Lithuania, and Estonia yesterday in a closed policy dialogue, and we do know that there are serious problems still with access and inequity, even within the European Union, let alone when we look at the wider European region. But I think working together with common objectives and goals, we will have difficult conversations, but we will find the solutions, because there is no other option than to do so. And in fact, we will be working to set up the platform. We will be consulting, and we would like to engage with all those who have been involved so far, but even if there are others who would like to come on board, please do so in the coming months to set up the platform and to take this, what we call post-OMI work forward. Finally, coming to digitalization and data. We were very pleased to launch our Digital Health Action Plan a few weeks ago. Why does WHO get into digital health? We get into digital health because for us, digital health is not a silo. Digital health is a lever, is transformative, but it needs to work for patients and to the benefit of patients, and for health workforce and to the benefit of health workforce. And what we are seeing is that in spite of the huge investment that is going into digital technology, we still lack the norms, the evidence, the standards, the bar, so to say. Those of you familiar with the medicines industry know that for the past 70 years or so, we have had a bar for quality, for safety, for efficacy. What is our bar for digital technologies from the patient perspective, from the financing perspective, from the health workforce perspective? When we come to country capacity, many countries really lack the capacity to implement these large-scale transformations. Health workers sometimes lack the competence and the confidence to implement digital transformations. And digital transformations do not always put patients at the heart of the solutions. Again, over here, we need to acknowledge that we need to work with the industry to find solutions together. This is new for WHO, but we are determined to do this and set up these platforms both for medicines and for digital technologies. Finally, if we want to build a better future that really puts health at the core of our activities, as a mother of 3, well, I have everything now, post-teen, teen, and pre-teen, I think we need to be listening to young people far more. We need to be trusting them, and we need to be engaging them. Because this is also where the trust in the future of Europe lies, linking again to the European agenda more broadly. So they are willing to engage. Let's engage with them, but not in a tokenistic manner, but let's engage with their energy, their creativity, to help us find the solutions to some of the very difficult challenges we face ahead. Thank you very much for inviting me to share on behalf of WHO our thoughts and what we are doing. And we look forward to continuing to work with all of you.
Natasha, thank you. Gosh, could I invite you to take a seat on the panel, Natasha? What a lot in there. I'm glad to see a lot of you were taking photos of those slides, so much information. Joining Natasha on the panel, I'd like to invite the rest of our guests up. We have Dolores Montserrat, who's an MEP, from a Spanish lawyer and politician. Natalie Mole, not only is she co-chair of the EU Health Coalition, also Director General of FPA, the European Federation of European Industries and Associations. And Lynn van Poelgeest-Pomfret, again, not only co-chair of the EU Health Coalition, she's also the president of the World Federation of Incontinence and Pelvic Problems from a patient advocacy point of view. And I'd like to also invite Michaela Calabro, Director of Eureka, which is the European Regional and Local Health Authorities Association. Michaela's also worked in European Health Management Association. What a fantastic panel. If you're able to take your seats, let's get...
Important.
Please add.
Ik heb iets heel belangrijk vergeten. Te bedanken met hart de Vlaamse parlement voor hun gastvrijheid. Dus veel dank.
Thank you. Thank you. So welcome to all our panel. MEP Dolores, if I could start with you, because we've heard so much in there already, and I was wondering what you'd like to pick up on, perhaps generally, right at the outset, hearing that health is wealth, how important that is, how fundamental. But from a politician's point of view then, how can you make sure that it's at the top of the agenda, that there's still the priority for investment in our health economies?
Thank you very much to be here, and thank you to Natalie and Lynn, and and I'm so happy because Lynn said that just landed from Spain, from Marbella, so this is good for me because that Spain is a gorgeous country. Look, first of all, I would say that COVID gives us a lot of lessons, and one lesson, the first lesson, it is that we put public health on one of the most important priorities in all Europe. It is true that before the COVID, we were thinking that, well, all the state members, they have the competence. So the European Union, we were not looking so much the public health, just, border problems, but not like now that we are building the European Union for health. I think that the first learned lesson, it is that health protection is a strategic sector in the European Union, but not just a strategic sector. Health now, it is defense and security in Europe. Because I'm concerned and worried about, what about the cyber attacks, hybrid wars. We have a lot of enemies, out of Europe, and they won't attack us. So we have to protect health, patients and health, because now it is a strategic sector, but in the same time it's defense and security for our patients. For me, it's this one of the most important lessons learned. And then, of course, we have to build this European Union of health to be European strategic autonomy in health. Before COVID, we've not been autonomy. We saw at the beginning of COVID time the health nationalism on our state members. But at the end, European Parliament and the Commission, we said, wait a minute, the state members, we think that we have to work together, not just all the public sectors, all the level, all the administrations, with all the stakeholders, patients, industry, and all the administrations levels, local, region, WHO, of course, local regions, then national, and then the European. So for me, perhaps the most important tool that we put on the table is the European Union of Health that puts on the center the passion. Second thing for us, very important, is the competitiveness of our pharmaceutical industry in Europe, made in Europe. This doesn't mean that the capital has to be from Europe, but Europe has to be more autonomy. We have to have more autonomy. So this is the reason that we need to produce, to innovate in Europe, because we don't want to be at the beginning of the COVID time that we didn't have a lot of raw materials and a lot of things that we need to protect our patients of COVID. And then, of course, that the European Union for Health, it's very important to maintain the sustainability of our public health systems in Europe, because one of the most important things that we have in Europe is the universal access for all our patients. China, they cannot say the same, and United States, they cannot say the same. So perhaps, in my first intervention, I stop here. A lot of lessons.
There's a lot in there again. Thank you so much. And you've mentioned patients, you mentioned the industry. Patients next. Lynn, what about from your point of view? There are examples of good practice, of things that are really working well. What would you like to highlight that could be taken further as best practice in Europe?
Okay, well, first of all, we're talking about a union, as you've said. A union means involving people, and that also involves patients, patient representatives, advocates, call it what you will. I'm going to give you a concrete example rather than repeat all the wonderful things that are being said now. My organization is working very closely with the scientific societies. This is key to get the patient collaboration for a particular disease area, it doesn't matter which it is, particularly, with the doctors, healthcare professionals in general, and extremely exciting, at the end of November, I will travel to Madrid to a conference where we will actually establish a formal collaboration with the International Continence Society, which I'm working with, to actually put this into a tangible form, the doctor-patient relationship, not within the silos of a patient or a doctor, but together, to get truly patient-centered health care. It's meaningless if it's just words. It has to have some kind of basis, a practical implementation, and this is what we're working towards, to actually have a blueprint which can be panned out then to other organizations, other patient organizations, other scientific societies. One word which I've sort of taken on board this morning is complacency. We cannot be complacent. We have to act and act now, which is meaningful for the average individual. The average patient, the average person couldn't care less about whether it's digital or data space or access. They just want the care they need, the medicines they need. And this is why we're forming these collaborations, which I think will trickle down somehow and actually have some form of meaning.
Lynn, thank you. And I wonder, Michaela, let's hear from you about, we're talking about that cross-border, the integration from the perspective then of the regions. How do you see the role of the regions in building this more resilient system?
Thanks a lot. So I think well, it's an honor to be here, first of all. So I'm very pleased to be part of this panel. And I think linking to what you just asked about the role of regions, I think it's an essential role. And I want to start to what Marilyn said in the introduction about doing and not just talking about. And I think a lot of the doing, a lot of the implementation in many member states, of course, in particular, comes through the region. And comes to the region in different ways. It comes to the region because they cannot really as a natural bridge between the patients, the individuals, the healthcare professionals, hospitals, the national level and the European level. And I think this can go in many different ways, actually. It can go in the way of getting from the region first-hand data information about what is working and what is not working at local level, so really capturing what is needed to shape better policies that leads to effective resilience, actually. There is a second level of implementation, as I mentioned, so all the European Health Data Space and all the other European level initiatives that are happening, I think, will find the space to get implemented mostly at local and regional level. So it is essential to then look at what is happening and what are really the obstacles or the things that are working better on the ground. And talking about what's working better, maybe, also regions can really act as a good repository of best practices. And often they act as a sort of natural laboratory also for cross-border cooperation. We work with several regions in Euriga, of course, but for instance, when COVID-19 started, in some occasions, it was between regions that was possible to see how really cross-border travel was influencing, for instance, the capturing of a case of positive people, try to understand how to collaborate cross-border between moving patients to one country to the other. That happened at regional level because there was already like years and years of collaboration happening. So again, this third element of really looking at as a laboratory of European integration in a way, I think that's quite important.
I like that idea, laboratory of integration. And Natalie, from the pharmaceutical industry perspective, we've known for some years that as a region, Europe has been losing ground to other areas of the world like the US in terms of innovation. One of your key planks in that is about boosting the research, development and innovation. So what more is needed then to keep Europe at the forefront?
Well, thanks, Sue. Yeah, it is something that we've been saying for a long time. And last week we published some figures EU-wide. We went national just to really understand what it actually looks like. And it was a bit scary for a researcher like me to see that a quarter of the R&D has left the EU in the last 20 years. That's a lot. And why is that scary to me? Because it means that things like clinical trials are being done elsewhere. So if I look at CAR-Ts, you know, super hype and wonderful solutions, in the last 2 years, the clinical trials have tripled, but 2 out of 10 are in the EU, and most of them are in China, which means they're not reaching our patients, which for me is the basis of innovation, right? We can't have an EU health union without innovation because it'd be completely, it's a bit like we can't have anything without a healthcare force. And that was really so well said, Natasha, and you really brought it home. I will not forget that. And so I think what we're really looking for is the right ingredients. We have less money in the EU, it is a fact. We just have to accept that we are not comparable to a country like the US. It has always been like that since I've been working in biotech. There is less money invested here. At the moment, the gap is 25 billion euro difference between the investments in the US, the investments in Europe. It was 2 billion 20 years ago. Okay, but we can do something about that. And I really think that the moment that we have the EU Health Union, the pharma strategy, the desire, which I hear from all sides, that we all agree that we need to create a better environment, we can absolutely do that and make sure that it coincides with improved access if we work together. It's very important, though, to choose the right policy tools. And I think in that, a discussion, a very frank and open discussion of what policy tools will actually help address which problems is important, because we're hearing discussions where we're concerned about connecting innovation tools with access tools that will actually not make us more attractive. So I think, we have our recommendations. Hearing yours, Natasha, your areas of work, it sounds a lot like our 9 recommendations. So I think we all agree on what needs to be done, but we really need to discuss how to do it the best way and use the different stakeholders and their expertise to check whether the proposals that are being made, the policies suggested, will work. Because we only have one chance at this in Europe today. If all of this is happening, to reverse that, it's going to take the right policy tools.
Yes, thank you. Well, it's great to see some questions coming in. Do pop your questions into Slido and raise your hand in the hall if you want to put up one. To Natasha, a question that's come in here. It says that you are right. This is from Oliver Bissaras from MedTech Europe. Natasha is right to stress the troubling plight of Europe's healthcare workers. What does the World Health Organization Europe think should be done at EU level to tackle this common challenge? You raised it, you're aware of it. What can we do?
So we are very much looking forward to try and establish, as we have done, for example, already now in mental health, that we have decided, look, I mean, as organizations, it might surprise people in this room. Coming from a small country, from Malta, when I joined the World Health Organization, I think I was struck by actually, for an organization which such a small and lean capacity, how much it manages to do just by leveraging the capacity of others. It's the same really for the EU too. So I think what we are doing as organizations is saying, actually, we need to work very much together where our policy objectives coincide, and they do coincide. So I'm hoping that as a year ago, we launched the Pan-European Mental Health Coalition together, Dr. Kluge and the Commissioner Kyriakides, and now it is with a sense of satisfaction that I can see that the cogs are in motion and we are working together in practice. And I think that the EU has really understood the importance of mental health and investing in mental health. I think my call today is that a year from now, I hope to be sitting here and reporting that the same has happened with workforce, and that we have a joint flagship program to work on what needs to be done with the workforce. And it's a whole systematic approach. So it's about investing in data and data systems, because if we don't even know what workers we have, I didn't go into the detail, but that report really just covers 6 groups of health workers. There are so many other workers that we don't have any data about at all. And what we can't measure, we can't manage, and we can't change. So I think data is one area that we can work on, but another one is even just working with the education sector, for example, on the production pipelines. It needs to be very clear that countries need to be able to forecast the supply that they need, not today, but in 10 years' time, and to be able to produce the numbers that we actually need. But we also need to understand that there are not going to be enough numbers to go around, because Europe as a continent also has a demographic profile, which means that all the sectors are competing for the best young people to join them. In healthcare, the beauty is that we offer employment for everyone. It's so broad that we can capture those really high flyers that have had 15 years or more in education. But we also provide jobs and employment for people perhaps who have lower qualifications and still would like to contribute and fulfill their role in society. So that's the beauty of healthcare also. So I think we can work together to make sure that the data is right, that we produce what we need to produce, that we address retention of health workforce in rural and remote areas. This is, again, another priority for the European Union when we think about the regions, when we think about the structural funds, when we think about everything that is going into renewing rural areas. You will not get renewal of rural areas if the people living there can't get access to healthcare. They will just leave and leave in droves. So I think it's all very interconnected, and if we sit together, we will find that the touch points go far beyond, for example, DG Santé, and that it is something that we can work with practically all the DGs in the EU on.
Thank you. And we have, as MEP Dolores Montserrat is with us, a parliamentary policymaker. So Dolores, there's a lot in there. Natalie talking about the right policies for the pharmaceutical, the health workforce issue, the need for data to measure this and therefore to be able to fix it. And Michaela talk about the regions. With so much there, is there something, can you give a nice pithy idea of what the focus is? From what you've heard here, what do you want to take forward in terms of policy?
Well, first of all, to put the focus, who did imagine 5 years ago that we, European Union, all together, we would achieve in record time, 1.5 years, innovation, research on a vaccine, a new vaccine on COVID, joint procurement, massive vaccination in all Europe, and then, with our solidarity, export this vaccine. So if we achieve, we can do it now. So we put on the table the European Union of Health, so we need believers. And of course that we are believers all on this table, and I'm sure that all in this meeting room. Because Lynn was asking us, doing, act. We don't want more talks, we want act and doing. So I'm going to put, for example, now the focus on the European health data space. Of course that it's going to be incredible, because it's going to give us progress on prevention like never before, early diagnosis, treatment and research for all chronic and infectious disease. But we have a problem. One problem that I can feel it's fear. It's fear. Well, me as a state member, perhaps I'm going to lose my data health space that I have, I don't know, in Spain or in all around the 27 countries. So the first thing that we have to do is without mental barriers, without fear. We have to do what we did 1 year before now, in just 1 year before, because in 1 year before, here in Europe, we did what we were prepared to do it in 20 years. So come on, let's do it. For who? For the patients, for all the European Union. And of course, as Natasha explained us before, Europe is an inspiration. European Union is an inspiration for the rest of Europe and for the rest of the world. So we can do it. I'm a believer, and in the European Parliament always I'm trying to push for this change, but the first thing that we have to change is our borders in our mind, in all the levels of the administration, and I'm looking to Michael too.
Let's pass it to Michael then. So on that, I mean, you've got experience working in Digital Europe in the past. So what about this background of the issue of data and what we need to do, the mindset, perhaps the paradigm shift we need to make? How can we do that so we just get on the front foot with digital?
Well, I think, and that actually goes back to maybe one of the recommendations is most important. It's investing equally in the technology and also in the skills and literacy of well, everybody, you know, from individual citizens to health workforce, but also politicians and administrators as well. Because I think that's the only way we can actually make the most of transformation. Digital transformation is happening, that we want it or not. It's a good thing. But to then make the most out of it, you know, having that innovation and actually serve for a purpose, and it's not scaring and it's not creating additional mental health stress for the health workforce, or it's not being left on a shelf because patients don't want to use it because they're afraid of their data is used in a different way. I think that's about creating trust, and you can create trust also by investing strongly in literacy and skills by everybody that is going to use and be involved in data, digital transformation. transformation.
And Lynn, from the patient's perspective, that issue of trust is a key thing. The questions come in that you might like to take. How does the patient voice get heard, especially when we have overlapping similarities in health innovation? We belong to a smaller European umbrella organisation representing national members across Europe. So getting that patient voice heard and addressing perhaps some fears that were touched on about using technical innovation.
Okay, I think this looms large and is quite frightening for many patients or patient organisations, especially the smaller ones, who are doing a grand job but with very little means, very little know-how, and the European Union is this big machine out there, and there's us. So where does that fit? There must be a far closer synergy. How to do that? I'm looking at Dolores and other people, how to bring in exactly that patient voice and multiply that n-fold, not the big beating cancer plan or mental health. It's the little ones who are doing a grand job, who are dedicated, who are passionate, but don't know where to turn, basically. And I think it's our job here within this room to facilitate that process. And I'll take that one stage further. You were talking about young people. Young people are key. This is the future. If we look at some of the other generations, perhaps, that aren't digital savvy, who regard this data space as some big giant out there, which is frightening, but young people have a very different approach, social media and the like, and I think we need to latch on to that and use that to best advantage, and that'll bring in the public, patients, whatever. If I look at these figures that you were talking about, the non-communicables, this is massive, and we really need to align what we said, the union. We haven't to be complacent, and we have to take that forward. And I'll come back to this, we do it now.
Thank you. And there's a point picking up on that. I think you're so right. My youngsters have no qualms about how much they put out there on their data. And I'm always clearing all my cookies from everything every day. Maybe it's a generational thing. The comment picking up on what you've said there, Lynn, saying, is it really fear that's an issue, or the assumption that fear holds us back? Many small research has shown that most citizens are not fearful of their data being used for research. And certainly other patient groups I've spoken to, the patients were only too willing to get involved in the clinical trials and so on. We've got so much here. We've just set the scene in this opening session. Very, very briefly, I'd like to ask each of our panelists that all those recommendations that are in there, the issues, pick out one. I want you to say that would be your first focus. Michaela, what would you first go for?
Well, I think I just briefly mentioned already, like, matching the investment in digital transformation with skills and literacy boosting for everybody.
Lovely. Natalie?
I'd like the one on monitoring centers for innovation and clinical practices, and how the uptake of clinical practices and access to medicine is being followed. I'd love to have a European way of monitoring that so that then we can measure and act.
Okay, Lynn?
Multi-stakeholder partnerships that are meaningful.
Lovely and brief. Natasha?
I think for me it's about really being patient-centric in reality, looking through the eyes of not just patients really, but citizens, because we can all be patients at any point in time.
Exactly, we all are. Look, Dolores, your key issue.
Let's invest in health to build a strong European Union on health. We have funds, because we have the next generation funds. Let's use it.
Lovely. And everybody taking part here can also vote. When we go into the break shortly, you can vote on which you think are the most important priorities in those recommendations. Also, as you wander around, you will see there's a couple of artists. We've got Sophie and Maria doing visual representations of what's going on today. And there is a way where you can get creative in terms of colouring in a lovely image of the EU Health Union. So do get involved in that. Everybody who's online, do come back and join us after the break. We're going to have coffee upstairs here, but for now, please join me, everyone, in thanking our excellent panel. Thank you. Thank you all. Well done. Could you come back at 11:40? We'll give you half an hour.